Hey there, gents. Today let's talk about a topic that might feel a bit uncomfortable but is super important. Reversing erectile dysfunction, or ED, especially if you're over 50. First things first, know that ED is common, and the good news is most cases are treatable. So what causes ED, and can it really be reversed at 50 or older? The answer is a resounding yes, but the first step is to get medical advice from your healthcare provider or a board-certified urologist. I get it, talking about your sex life with a stranger can be awkward, but the longer you wait, the longer you're putting off a more fulfilling sex life. Now let's dive into the solutions. A combination of medication and lifestyle changes is often prescribed to tackle both the physical and mental aspects of ED. Starting with medications, these are usually prescribed to help manage symptoms while you work on the underlying issues. The most common drugs are PDE5 inhibitors, which increase blood flow to your penis. These include well-known names like VIAGRA registered trademark, Sildenafil, Cialis registered trademark, Tadalafil, Stendra registered trademark, and Staxin registered trademark. If you're looking for something different, chewable hard mints with the same active ingredients are also an option. But medication is just one piece of the puzzle. Lifestyle changes play a huge role in addressing ED. For instance, maintaining a healthy weight can significantly reduce your risk of ED. Men with obesity are 3 times more likely to experience sexual dysfunction. Plus, obesity is a risk factor for conditions like type 2 diabetes and high blood pressure, which affect sexual function. So what can you do? Here are some actionable tips. 1. Stay physically active. Aerobic exercise not only helps with weight management, but also supports cardiovascular health and boosts sexual function. Aim for 30 to 60 minutes of activity most days. Think swimming, biking, tennis, walking, or strength training. 1. Follow a nutritious diet. Emphasize fruits, vegetables, whole grains, legumes, nuts, seeds, and lean protein. Minimize ultra-processed snacks and sugary drinks. 1. Quit smoking. Smoking narrows blood vessels, restricting blood flow to the penis. Men who quit often see improvements in ED. 1. Moderate your alcohol intake. Frequent heavy drinking can lead to sexual dysfunction. Stick to no more than 2 alcoholic drinks a day, as recommended by the CDC. And what about preventing ED in the first place? The habits that treat ED are the same ones that can help prevent it. So whether you have ED or think you're at risk, adopting a healthy lifestyle is a great place to start. Remember guys, there's no shame in seeking help. Your quality of life, including your sex life, is worth it. Thanks for watching and take care.